Hello everyone, my name is Ahmad Mustafa, and today we'll be presenting our paper, The Digital Provision of Sexual Health Information and Advice in Egypt. The paper is done by Ahmad Mustafa, Laura Fadl, Minna Shamil, Fatma Abdel Fattah, and Jihan Ismail. So let's start off the presentation by defining what sexual health is. According to the World Health Organization, it is a state of physical, emotional, mental, and social well being in relation to sexuality. So it's not just the absence of disease, dysfunction, or infirmity, it is the sexual prosperity of the person. Now, why is this important? Why is accessing sexual health information in Egypt important in the first place? And according to the literature, approximately 50% of Egypt's 101 million population are 24 years of age and under. This is usually the age where they start exploring what sexuality is, and so they want to learn about it. But due to the cultural constraints and the taboo on the topic, they start to do so privately. In fact, De Jong et al. 2005 supports this by saying that they seek non-specialist information from peers and parents, and from peers being pornography and unreliable sources. And this lack of accurate information can lead to problems like unwanted pregnancies, terminations, late diagnosis of health issues, and loss of sexual rights. And to top this off, the Egyptian's healthcare system is highly pluralistic, meaning that the government does not have that much power to put sexual health information in the curriculum of schools or universities. Now, there are challenges, a couple of challenges, of course. Accessing high quality sexual information is the top priority of this paper, tackling it, of course. And then there is the problem of the healthcare system that is pluralistic, and the, the topic itself being taboo is really a challenge to us. There's also that the information we already have is not really peer reviewed and depends on traditional cultural practices. And even the information that's already provided by the government is patchy and unreliable most of the time. So, there is a clear gap for concise, peer reviewed sexual health information that is culturally sensitive, that can be accessed privately and relatively safely. So, what if we can be the solution? I'll leave Fatma explaining our aims and objectives of this paper.
Thank you, Ahmed. So, our aims and objectives of providing sexual health information are clear, and they don't only help the youth of Egypt, but also they could help people across the developing countries. So, basically, our first goal is to provide sexual health resources and information through professionals in this field, and to provide this services through the internet and modern information and communications technology, or ICTs, that are freely available and easily accessible, like applications. Also, our aim to provide opportunities for developers and masters of ICTs to produce products that have social impact that are meaningful and culturally relevant, that can be used commercially for profit and in other areas of healthcare. So the last aim is to develop sexual health information and advice service that can be emulated in other African and Asian countries.
Okay, so in this research, mixed method research design was used, and that has great benefits such as providing high quality findings that has scientific power that can be tested for validity and reliability through data triangulation. So we aim to collect the quantitative data through social media platforms such as Instagram and Facebook. Additionally, handwritten surveys will be distributed to the Department of Psychology in the British University of Egypt. Moreover, the qualitative data will be collected through in depth interviews with diverse organizations and individuals, such as academics, sexual health service providers, the health minister in Cairo, and the health, yes, okay, And also the focus groups will be with young people and their significant other in various locations across Egypt, which will be recruited through the psychological department of the British University in Egypt. So after the data collection, multivariate regression analysis will be used for the quantitative data, which allows a single regression model with more than one outcome variable. While grounded theory, which is to identify theory from data systematically, is used for qualitative data, along with cultural consensus, which is used to identify the groups with shared values. So, regarding the ethical considerations, they will be followed from the American Psychological Association along with the British Psychological Society. So here the anonymity and the confidentiality of the participants' data will be in particular consideration. Also, the sensitivity in the data collection that may be culturally sensitive in terms of communication, as well as the vulnerabilities of collecting data from young individuals in regard to the sensitive topic. So here is the anticipated time frame for the 3 phases for the upcoming 3 consecutive years. Thank you.
So my name is Jihan, and I want to mention the fact that this project is one of great commercial viability. There's no single known app that has the same idea of providing sexual health information for all ages within a Middle Eastern cultural context. So this project will be the first of its kind, and it will be scientifically informed, easy to use, accessible, and innovative, providing reliable information and not just information that is received from peers or so. And it is an investment. It's worth every dime to teach an entire region about such a vital aspect of their well-being, sexual health, aside from taboos, aside from constraints, because every person deserves to be at the best health that they can, especially with sexual health. So, in conclusion, young people in Egypt face challenges in accessing reliable specialist sexual health information and advice, and we propose that the delivery of such information can be and should be delivered by modern technologies, and this could be in the form of virtual reality formats for use in a range of engaging formats, including video and audio. So we aim to make it as interesting and simple and accessible as possible to promote better sexual health in the Middle East, and particularly in Egypt. So that was our presentation. I'm so proud, me and my colleagues, and we're so happy to join such competition. And we are excited about our idea, and we are very, very passionate about it. Thank you for listening. Thank you for your consideration, and goodbye. These are our references.